Chesterfield and her long tenure as efficiency chair for her work with these individuals. It's a very important, she did a lot of work with our staff. And so with that, I would just ask everybody for a moment of silence for Mary Jacks and for Frank Witherspoon, Staff Sergeant, retired. Thank you.
Thank you, Senator Ervin. Members, we need a motion to approve the minutes from the December 5th meeting. Motion a second. All those in favor say aye. Opposed? Minutes approved. First up on the agenda, we're going to item D. Someone from DHS wants to come and present that rule. You can just state your name and you're recognized to present when you're ready.
Mitch Rouse, Chief of Staff, DHS.
Elizabeth Pittman, Director, Division of Medical Services. I'm very tall today.
You're recognized to present.
First rule we have today is to amend the medication-assisted treatment and over-the-counter drug rule. This is pursuant to changes under the SUPPORT Act. It removes some PA requirements, changes some of the drugs available for over-the-counter, and complies with that act. There were no comments received from any providers or stakeholders. CMS did ask us to make some technical changes and corrections to the form of the rule. We had accidentally modified their template, but other than that, there were no changes from CMS either. Happy to take any questions.
Members, are there any questions? Seeing none, without objection, this rule stands reviewed. Ready to present item E?
The second item on the agenda is the adult immunization mandatory coverage rule. This is again something required by CMS, and it's to cover all adult vaccinations recommended by the United States Public Services Task Force. And so that's their A and B recommendations. We already covered the majority of those vaccinations. We're adding 4 additional ones for adults, and that's 19 and over. And again, happy to take any questions.
Seeing no questions, without objection, the rule stands reviewed.
And the last rule I have today is the coordinated triage, treatment, and transport to alternative destinations rule. This rule is being promulgated pursuant to Act 480 from last General Assembly, and it allows for ambulance services to treat on-site or transport to an alternate location, not an emergency room, if they consult with a physician or a licensed behavioral health practitioner. We did work with the ambulance services to draft this rule and get it promulgated, and it has received CMS approval. And again, happy to take any questions.
Members, are there any questions on this rule? Seeing none, this rule stands reviewed. Thank you for your time.
Thank you.
See, next up we have the Department of Health. Item G. If you can just state your name for the record, and after stating your name, you're recognized to present.
Charles Thompson, Attorney, Arkansas Department of Health.
Shane David Branch, Chief, Health Systems Licensing Certification, Department of Health.
Craig Smith, Attorney for Arkansas Department of Health.
Mr. Chair, Madam Chair, thank you for having us today. Members, thank you for having us this morning. The first rule you have in front of you is the Rules for Control of Sources of Ionizing Radiation. I know that's a very, very big document, but what this is the document that we go by as the designee for the Nuclear Regulatory Commission when it comes to radioactive materials. There's nothing substantive, major substantive changes in this rule. This is cleanup. This is to ensure that we match, that our language in the rule is compatible with what NRC's requirements are, and also what it's to ensure the consistency with our rule language with the state statute. There's a mention of fees in there. You'll note that at the front. There's no increase in fees. There is no change in fees. There is no additional fees. That is to ensure that we had some old language regarding the type of licensure, the nomenclature used. That is updating that language, and also to ensure that that's compatible with what the NRC has. Also have Dr. Shane David here, who's over that program. If y'all have any more in-depth questions, we'd be happy to answer them. Thank you.
Members, are there any questions? Seeing none, this rule stands reviewed. Without objection, this rule stands reviewed. Do you have item H as well?
I do, Mr. Chair. Members, you have before you the rules regarding radio RadTech licensure, and the only change in that is compliance with Act 137 of 2023, which was an update to the Military Members and Military Veterans Automatic Licensure Act. Be happy to take any questions.
Members, are there any questions regarding this item? Seeing none, without objection, this rule stands reviewed.
Thank you.
Item I, is that also you?
Mr. Smith's going to handle that one, and we do have a subject matter expert from ADH coming up.
Okay. If you could just state your name for the record.
Good morning, Paula Day, Section Chief for Health Facility Services. Thank you.
You're recognized.
Thank you, Chair. This morning, we are here to present the rules for perfusionists in Arkansas. The only changes are to comply with Act 137 for automatic licensure for uniformed service members.
Members, are there any questions about this rule? Let's see. Senator Love, you're recognized.
Thank you, Mr. Chair. I'm looking at this. What are perfusionists?
A perfusionist is someone that does the interchange of blood during like open heart surgery. So they put patients on blood, lung and heart machines. So that machine is what's beating their heart and running their body while open heart surgery is going on.
Okay, all right. Just wanted to know that. I didn't. Thank you.
Members, are there any other questions? Seeing none, then without objection, this rule stands reviewed. This brings us to item J.
Thank you, Chair. Second rule we have is rules for orthotic, prosthetic, and podorthic providers in Arkansas. The only changes to this are also for Act 137 for automatic licensure for uniformed service members.
Members, do we have questions? Seeing none, then without objection, this rule stands reviewed.
Thank you, Chair.
This brings us to item K. If you can just state your name for committee, Ms. Hsu.
Thank you, Mr. Chair. Members of the committee, I'm Laura Hsu. I'm General Counsel for the Department of Health, and we're here to present the rules for abortion facilities in Arkansas. This is a repeal pursuant to Act 162 of 2023, which was sponsored by Senator Ervin. We had a public hearing. After a public comment period, we received no public comments, and we're proposing to repeal this rule for abortion facilities based on the Act today. Thank you.
Members, are there any questions for the Department of Health on this rule? Seeing none, then without objection, this rule stands reviewed. Item L, is that you also, Ms. Hsu?
Thank you, Mr. Chair. We're here to present item L, and I also have present with me Dr. Katie Seeley, the Director of the Public Health Laboratory. I believe several of you all have attended some of the tours of the Public Health Laboratory, and if you have not done so, we would welcome you to do that, and we can set that up for you. Today, we're here to present the rules pertaining to testing of newborn infants. We had a public comment period from October 20th through November 19th. The rule is being amended pursuant to Act 490 of 2023. We received no public comments and are happy to take any questions.
Representative Wardlaw, you're recognized for a question.
I just find it interesting that I see Matt Gilmore in the audience, but he hasn't been to the table. So I was wondering if he had anything to add. I
hear no comments from Mr. Gilmore. We're grateful for your presence, sir. Thank you. Members, are there any other questions for the Department of Health on this rule? Seeing none, then without objection, this rule stands reviewed. Thank you for your time. Members, that brings us to the end of the agenda. Does anyone have any other business for the committee? Seeing none, tentatively, we're going to be looking, I think, at February 8th for our next meeting. Everyone can just kind of look at that. That's going to be the second Thursday in February. We'll be getting with committee members to get the time lined out, and we'll go from there, okay? Without any other business, this meeting stands adjourned.